What are the different causes and treatment options for adult scoliosis? When adults are diagnosed with scoliosis, many times they don't understand what the cause of scoliosis is, and they don't understand what treatment options they have as a result of their scoliosis. Well, first thing we have to understand is that when you're diagnosed with scoliosis, what does that really mean? A scoliosis is an abnormal or unnatural sideways curvature of the spine from the front view. And the scoliosis or the curvature also has some rotation that occurs, normally a rotation into the concavity of the scoliosis. And this rotation and angle of curvature must be of 10 degrees or greater for it to be diagnosed as a scoliosis. So once you have a Cobb angle of 10 degrees or greater with rotation, that is a diagnosis of scoliosis. When we look at what age group that scoliosis is most prevalent, most people think that adolescent scoliosis is the most common age group when it comes to having scoliosis, and it's typically diagnosed as something called adolescent idiopathic scoliosis. And adolescent idiopathic scoliosis stands for unknown cause. Even though that we think of adolescent scoliosis as the most common group that we think of, however, scoliosis doesn't only affect adolescents, it also affects juvenile cases, and it also affects adults. And when we look at adults, what types of scoliosis cases affect adults? Well, the first type and the most obvious type is when we have adolescent scoliosis that now the person now ages into the adult stage, 18 plus. They had scoliosis developed in the adolescent stage, it was diagnosed, and now the person is now 20 or 25, 30 or 40. So now they have adolescent scoliosis in the adult stage. A lot of times they may not ever get diagnosed in the adolescent stage because sometimes they never became severe enough for it to be diagnosed. So many patients may have adolescent idiopathic scoliosis and not even know until they get diagnosed later as an adult by some other reason, meaning they start having some kind of pain or some kind of problem, or they have an injury or a car accident, or they get an x-ray or some type of imaging for some other reason. They say, hey, did you know, do you actually have scoliosis? And unfortunately, that tends to be very common that patients actually find out that they had adolescent idiopathic scoliosis when they're an adult. This change that occurs into this adult stage, what ends up happening is adolescent cases are not painful, but unfortunately, adult stages tend to be painful. So the most common thing that brings on the diagnosis is pain. Degenerative changes can occur to the spine, and this happens as a result of misalignment. The spine starts to degenerate, and when it degenerates, it causes the spinal bones to degenerate abnormally into an abnormal shape. When these discs start degenerating into an abnormal shape, they can actually lead to something called degenerative scoliosis in the adult form. This degenerative changes can start to affect spinal discs, and spinal discs can also go degenerate. When discs start to degenerate abnormally, they can start affecting the position of the spine as well. Both of these degenerative structures, either the bones or the discs, can lead to curvatures. Now, what's the number one symptom when we look at an adult case? It's unlike an adolescent where the number one diagnosis tends to be postural. We see some kind of a postural problem. We see some kind of misalignment within their ribs or shoulders or hips or waist that normally to spark an x-ray being taken, and that x-ray typically leads to a diagnosis of scoliosis. In the adult form, it's completely different. The number one symptom tends to be pain. Back pain, radicular pain, stiffness, abnormal ranges of motion. This pain tends to become more and more common in the adult stage because when scoliosis progresses as an adult, it's progressing as a result of gravity compressing the spine over time. This compression leads to pain. This pain typically leads the patient to go get examined by a physician. Maybe they're doing some postural range of motion exams. Maybe they're just taking x-rays as a result of pain. They find out that they actually have scoliosis. So the number one symptom in the adult stage is normally pain. Secondarily, it's postural changes. You start seeing their spine start translating, their body start translating, uneven shoulders, rib arching, the same kind of things we see in adolescent. But the problem is it occurs and progresses much slower over time. And since it occurs and progresses much slower over time, patients tend to not respond as quickly, and it tends to progress to a more severe state in the adult stage. Since scoliosis is always progressive, even in the adult stage, it worsens over time. And since it worsens, as it becomes more severe, it becomes more difficult to treat. The way to determine severity of a scoliosis is you determine it by the size of the Cobb angle. Cobb angles that are 25 degrees or less are considered a mild scoliosis. And in a mild case, If it's left untreated, it can progress into a moderate curve, which is curves between 25 and 40 degrees. Once you break 40 degrees, now it's considered a severe scoliosis. And I like to use a fourth category, something I call very severe, and this is when curves are 80 degrees or greater. Now, scoliosis treatments differ whether it's an adolescent or adult case. Now, unfortunately, young patients or adolescent patients are at risk for rapid progression, and this is a result because they're growing rapidly. And since they're growing rapidly and they have a curve, they have the chance of progressing rapidly. Now, interesting that as the curve gets bigger, it's more likely to get bigger during growth. So if you move from a mild curve into a moderate curve, your risk of progressing every time you grow is higher. So the bigger your curve becomes, the more likely it is to progress rapidly. So even for younger patients, treating early is better. In the adult stage, curves don't progress rapidly anymore because in most adult stages, because now it's a result of gravity over time. But in late stage life, meaning when patients start getting 70, 80 years or older, there tends to be a rapid progression phase again because of the accumulated progression over time, the spine deteriorating over time, and gravity having the effect on the body over time. And as the body becomes weaker as a result of age, this progression tends to be can occur more rapidly. However, more commonly between 20 and 40, curves progress very slowly. They say anywhere from a quarter degree to 1 degree a year. Once you break 40, the curves start to increase the rate of progression at this stage. They double whatever they're doing before. Once you break 60, they double again. And like I mentioned, once you get to 80, 90 years of age, they can start progressing very rapidly again. So therefore, we like to focus treatment more on slowing down or stopping progression, because if curves progress during your adult stage, this progression over time causes more pain, causes more deterioration, causes lots of more issues. And unfortunately, adult patients don't respond well or have a less good prognosis when it comes to scoliosis surgery. So a lot of times this progression over time can leave patients in a place where they don't have any options to treat their scoliosis surgically. And if the curve becomes so severe, it becomes very difficult to treat it conservatively, even though no patient is ever too old to treat a scoliosis conservatively. But however, we get much better results treating curves when they're smaller. The goal is always in adult patients is to reduce the curve, because that's what's causing the problem. But a successful treatment is not just curve reduction. It can be on stabilization. It can be improving pain and function. It can be preventing more spinal deterioration and stabilizing the progressive nature of scoliosis in the adult stage. So we always recommend that if you're an adult that has scoliosis, that waiting for your curve to become severe or waiting for your curve to cause lots of problems is normally never a great idea. We recommend definitely evaluating your curve early and start managing or monitoring your scoliosis minimally to see what type of progression is occurring. And we definitely recommend it's much better off reducing a small curve and not letting a curve become severe, because it's definitely more difficult to reduce as the curve gets more severe and as it causes more and more issues. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.